Hi, my name is Cassandra Thomas, and I will be doing my educated citizen presentation and how it relates to my public issue, sex trafficking in Nebraska. I chose this issue because there's a rising amount of cases of women and children being victims of sex trafficking. As a future nurse, we should raise more awareness about sex trafficking to our patients in the pediatric population. Throughout my time in clinical, this has been a reoccurring topic that has been brought up between my patients and I. They have expressed how sex trafficking affects them and their future, along with where and how they can reach out for help. Every month, about 900 individuals are sold multiple times in the state of Nebraska. First, an effective communicator uses critical thinking to generate, connect, and organize ideas in a written, oral, and nonverbal manner. My first experience was during my medical surgical rotation. I took care of a patient that only communicated using American Sign Language. I enjoyed caring for this patient due to my previous knowledge of this language. Prior to entering my patient's room, I reviewed how to spell my name and relearned how to say different phrases again. The patient was able to express his frustration of not being heard or understood during his time within the hospital. I was able to give the patient opportunity to express his fears and questions about his diagnosis. Towards the end of my clinical shift, I was able to communicate my patient's thoughts, feelings, and emotions to his nurse. I even took the time to teach the nurse some easy and quick signs that she'd be able to use to help communicate and make the patient feel more welcomed. I understand it is difficult to communicate with others that speak a different language, but as future nurses, we need to find a proper way of communicating with our patients. As a nurse, I will go out of my way to make sure that the patient feels more comfortable to communicate with me through verbal and nonverbal communication to build a better, trusting relationship. Communication is key when caring for a patient. This includes communication between healthcare professionals. Nebraska Methodist College taught their students about the importance of being culturally competent, which enhances the importance of having proper communication. When a nurse is presented with a language barrier, we need to make sure that all the proper steps are followed to help communicate with this patient, like using an iPad to help translate or obtaining a translator. About 80% of sex trafficking victims come out to healthcare professionals. As a nurse, we need to learn how to communicate and help sex trafficked victims that speak other languages. Victims of sex trafficking are usually tourist or minority groups, such as the Latino community. When we are better able to understand these victims, we can help provide them with the proper help that they may need. This also helps to raise awareness to other individuals who speak other languages. My second experience was during my geriatric nursing course. I was able to learn about ageism and how it may affect the care that nurses provide to their patients. Ageism is defined as stereotyping, discriminating against, or applying prejudice to older adults due to their age. Unfortunately, I witnessed ageism during my clinical rotation at a long-term care facility. The nurse I was assigned to described one of her female patients as being crazy, annoying, and incapable of doing anything herself. After hearing how my nurse was expressing her feelings about her patients, I witnessed how this negatively affected the care that she gave to the patient. The nurse did not take the time to hear the patient's concerns or even provide her with some of the information that she was asking about. During my clinical time, I took the time to reach out to the patient and listen to how she was feeling and answer any questions she may have. The patient expressed that she was upset about how the nurses were treating her during her time there. After I saw how ageism affected the nursing care process and talking to my patient, I pulled the nurse aside and brought to her attention that she was exhibiting ageism and how that was negatively affecting the patient and their care. During this time, I saw how this negativity was affecting the care that the nurse was providing to her patient. This made me realize how important it is to always be an advocate for our patients. We need to always voice our thoughts when concerning the care of the patient is receiving. As a nurse, we should be aware of any negative emotions, thoughts, and actions our coworkers may express when caring for patients of sex trafficking. If our coworkers are treating patients that are victims of sex trafficking, we should support our coworkers through how they are feeling and give them support to speak to someone. This allows us to advocate for the patient's wants, needs, and emotions. Next, we have reflective individual. A reflective individual routinely engages in the habits of inquiry that influence ways of thinking and actions. My first experience was during freshman year. I had the opportunity to analyze how I am as an individual and if I have any biases. We had an assignment to do research on a topic of our choice and present it to our class. The topic I picked was anorexia. And while conducting my research, I was able to identify any biases I have about this diagnosis and analyze my own beliefs as a nurse. I had preconceived thoughts about this diagnosis, such as it only affects females of a certain age group, the individual needs to show signs and symptoms, and it only presents as the individual being severely underweight. However, I was able to gain more knowledge and insight about my topic, and I quickly learned how incorrect I was. This experience allowed me to understand how nursing biases affect the care that nurses provide to their patients, and through self-reflection are able to correct these beliefs. As nurses, we have the ability to further expand our knowledge and understanding about topics that we have biases about, such as diagnosis, certain treatments, and religious beliefs. When helping victims of sex trafficking, the nurse must understand and recognize their own thoughts and feelings about this situation. We must analyze if we have any biases or emotions that may negatively affect how we seek care for these patients. We want our patients to feel comfortable and safe while they are also in our care. My second experience was during my pediatric oncology course. I was faced with many hard situations that I was unsure how I was going to overcome by myself. I realized that if I try to solve all my problems by myself without seeking help from others, I was struggling to understand the concepts that were being taught during class and how to answer nursing school questions. My grades started suffering severely, and I realized this is a problem that I needed to seek help for. I reached out to tutors, supplemental instructors, course instructors, and clinical instructors. We were able to talk about my fear of asking for help and the barriers I faced when seeking help when needed. After reaching out for advice and guidance, it taught me how the patients may be afraid to disclose certain information or ask questions due to judgment. As we face complications with our patients as a nurse, we may need to seek advice and help from others, such as their physician, other nurses, or even a rapid response team. When I ask for help, it will provide me with the opportunity to learn more as a nurse, provide excellent and safe patient care, and build a stronger connection to my coworkers within the healthcare field. I realize that I do not seek help when needed and avoid asking questions that are important. Nebraska Methodist College taught me that it's okay for me to step out of my comfort zone. As a future nurse, I promise for my patients that I will continue to ask for help when needed. I will continue to ask questions every day to help expand my knowledge and provide the best care that I can for them. As a reflective individual, I must always look within myself to make these changes I need to become a better person and nurse. Dealing with sex trafficking victims can take a great emotional toll on a nurse and team caring for this patient. When coming across this situation as a new nurse, it may be scary and frightening. We need to remember that we always need to ask questions and ask for support when we need it. When we ask questions, we are able to seek different types of support for our patients and ourselves within our healthcare team. We must also teach our patients that they should always seek help when needed, ask any questions, and know that they could rely on healthcare professionals to care for them in a safe manner and protect them. Lastly, we have a change agent. A change agent uses the disciplines of the liberal arts and sciences to analyze historical and contemporary situations and systems to develop cultural competence and to take appropriate initiative to effect change. My first experience is during my mental health rotation. I realized that there was a great opportunity to become a change agent through talking to the patients. The female patient I had the pleasure of talking to expressed her disappointment in the healthcare system when treating patients suffering from mental health diagnosis. She was able to talk about her past experience facing trauma in her family and being a part of sex trafficking. Since she has a history of being abused by male figures, she explained to the nursing staff that she would like to have female caregivers. The nurses, however, did not take the time to listen to the patient's story and her request for a female nurse. I felt as this was extremely important to disclose to the nursing staff and interprofessional care team. I was able to draw attention to certain improvements that need to be made to help increase positive patient outcomes. Being a change agent starts with the person to help spread awareness and change throughout the facility. After I brought attention to how my patient was feeling, the nurses pointed out that sometimes the communication support of our patients are lacking because we become so concerned with accomplishing tasks such as medication administration. If we take the time to listen to our patients, we will be able to care for them better and will allow for a trusting relationship. As a change agent, I was able to recognize where the change is needed to occur and recommend ways to implement change throughout the facility. When fighting against sex trafficking, we must want to make change within the law or the resources we provide to help combat trafficking. If we do not apply ourselves as a change agent, we will never see a decrease in the cases of sex trafficking. We need to listen to the stories that the victims trust to tell us and implement change in our society based on their stories. We can learn about why these individuals were targeted and make changes within the system. For example, A common reason for sex trafficking occurring within the underage generation is because children run away from their home a lot. If we create more safe houses for children, there will be less children trafficked. My last experience was during my medical surgical rotation. I was afraid to voice my opinions as a new nursing student and did not want to upset other nurses during my clinical rotation. The physician caring for the patient put in an order for a urinary catheter to closely monitor intake and output. Nebraska Methodist College taught and stressed the importance of this being a sterile technique to help decrease the risks of infections. However, when I witnessed the nurse inserting a urinary catheter, she was not inserting the catheter using a sterile technique. Afterwards, I sought out my instructor to ask her questions about this experience and advice about how I should handle this situation. My instructor pulled aside the nurse and the charge nurse to set up a meeting about properly inserting, caring for a urinary catheter. I had the opportunity to recognize positive change that should happen in the hospital and printed out copies of the hospital policy regarding inserting a urinary catheter. I was able to make a positive change in the training that the healthcare team received. The change agent must take time to listen, be a messenger, provide tools, assistance, and resources for positive change to occur. Negative weapons, such as judgment and finger pointing, are not effective for the change agent. As a nurse and nursing student, we are always looking for ways to make positive change within the healthcare system. Since I spoke up about my nurse, I was able to help decrease the risk of infection for other patients, which allows for a higher patient outcome. I was able to advocate for my patient and assure that their safety was my number one priority. This will also help decrease hospital costs due to hospital-acquired infections. My clinical instructor and the charge nurse were supportive and proud of me for speaking up about this issue as a nursing student. Any nurse can have a significant impact on the need for change within the nursing field. As a nurse, we need to teach the community to speak up and speak out about what they see and hear regarding sex trafficking. We cannot make change if sex trafficking situations go underreported. We need to teach the community to recognize when there is a problem or signs and symptoms that they should report immediately. We can raise awareness, such as starting a social media page and educating our patients and their families. As I reflect on my time at Nebraska Methodist College, I am able to evaluate how I have grown into a better individual and a nurse after learning about becoming an educated citizen. When becoming a complete educated citizen, it does not happen overnight or even during our time in school, but through the steps that we take in our life and throughout our career as a healthcare individual. Nebraska Methodist College provided me with skills and knowledge to apply myself as an educated citizen in the workforce, but also within the community to make a positive change. There are many skills that the educated citizen possesses, but the skills that have stood out to me and that I have applied are to always listen and hear what the community and individuals saying, the ability to reason critically and systemically, and to take initiative. These components help build an individual to become an effective communicator, a reflective individual, and a change agent. When implementing what I have learned becoming an educated citizen, I am able to apply those lessons on ways we could decrease sex trafficking in Nebraska. And these are my resources. Thank you.